Okay, let's begin our first session today, the first session of the Low Carb Conference with Shashikant Iyengar. For those, many of you would be familiar with Shashi's name, but let me give a brief introduction to Shashi. Shashikant Iyengar is India's most certified and SMHP accredited metabolic health coach. He's one of the senior most members of India's only low carb platform, DLife.in, and the man behind this event, and the co organizer, along with the founder of DLife.in, Anup Singh, of the first low carb conference, India's first low carb conference. Welcome, Shashi, and please tell us how and why did you think of organizing this very critical metabolic health conference in India?
Thank you very much, Ira, for having me on the session. And first of all, pranam and thank you to my guru, Anup Singh. So Ira, this was a dream which we had right from 2017. Me and Anup, we were always thinking that we should be holding such a conference because we have seen a lot of such conference happening abroad in US and in Europe and in many countries in Australia. So we thought, why not we have it in India? Initially, we thought of having it physical, but then later on, during the COVID time, we realized that virtual world is open to us and we can do something virtually. And then what happens was like, since I was also employed, so I couldn't do. And the moment I left my corporate job into full-time as a metabolic health coach, then immediately within a couple of months, we decided that we will hold this conference. Immediately, we fixed up a date, we announced, and then we started it. And I think this is something which we owe to India. We should be doing such a conference because these conferences will actually show us that there is an option beyond pills. Now, I'm not against pills because I'm from pharma. I've been selling all this medication for 35 years. I think everything has a role in human health. However, for those who think that they want to control metabolic disorders like diabetes, blood pressure, obesity, and many various other disorders, there is an option where you can either get off pill or you can lower it. And hence, we thought that we will hold this conference.
Yeah. Shashi, that brings me to the next question, which naturally is how is it so much relevant for India today, looking at the metabolic syndrome numbers that we have? And would you care to explain why is it that it is so relevant for India, especially?
I think in the inauguration, Mr. Cherian has already rattled out the numbers, the frightening numbers. More than 100 million cases with diabetes, 136 million with pre-diabetes, 36% of the population may be having high blood pressure. The incidence of obesity, childhood obesity, fatty liver, everything is very high. And we are not counting insulin resistance at all because usually insulin resistance is not at all measured. So I think such programs where we advocate a low carbohydrate nutrition or lowering the carb to whatever extent will help manage most of the diseases. And it will also help us understand that we can also prevent the full-blown, for example, we can prevent the full-blown diabetes by measuring insulin resistance and taking appropriate action. Now, what is appropriate action? That is lowering down your specifically your quick ultra-processed carbohydrates and excess sugars we can do. So I think India is in need for an alternate option to control metabolic disorder other than pills. So this is the main objective.
Yeah. Looking at the grandness and the grandeur of this event, Shashi, it just astonishes me the kind of lineup that you have, managed to assemble. The top speakers, the global doyens, as I always say, they're there. How did you manage to get all of them under, one roof on one platform, and at such a short notice?
See, I think first of all, I should be thanking all these speakers who have agreed to come on this platform and grace the occasion on the India's first ever low carb event which you are having. And I will say that this is a culmination of effort of last 8 years. Me and Anup, we are well known in the international circle. And in the last many years or last few years at least, we have gained a lot of credibility and our networking is very strong. Additionally, because I have done also a lot of courses, like I have done a lot of courses on Nutrition Network, SMHP accreditation, I'm also well known. So And the world over, the low carb nutrition committee people, they were actually looking forward for someone doing this program. So who will do? It is only us. We are the pioneers. In DLife, we are the pioneers who can do this.
Yes.
So who else will do?
Yeah. And how is it, Shashi? I mean, I can never wrap my head around. Maybe you can dwell on it a bit. How is it that such an event was never thought of in the Indian context? Never done.
I think,
We are.
yeah. So, like, coming back to the point again, see, many, I don't know if someone has ever thought of it, but then no one has that connect, international connect to do this. And Ira, if you see, we have fixed this in a very short term. Secondly, we had the knowledge of who is what, who is going to speak on what topic. And this is again the effort of what we have done for the last 8 years. We know that this particular doctor will come and speak on this particular will doctor. And let me come back to the main theme of this program, that is low carb across the globe. I had the or rather me and Anup, we had the vision of getting in maximum countries in this program. So we have 15 countries or 15 flags flying high. And we wanted to show to the world that there are medical doctors who are either practicing or advocating low carbohydrate nutrition, and that includes India also. So we have included sizable amount of doctors from India also who are either into full-time low carb nutrition, or they refer cases to many of us and they support low carb nutrition. So we have gathered all of them, and fortunately everyone responded very well. So I'm so touched by the love shown by the international community, and they were all waiting for someone from India to do. They are also so happy to see that someone has taken this initiative in India, and which we have done.
I'm sure. Shashi, there are so many sessions, 46 of them, and top speakers are there. I mean, as I said to Mr. Dilip Cherian, each session is worth reading many books. Why, for a first timer, for such an event is being done for the first time, were there any inhibitions that there would be 46 sessions? Why are there so many sessions? What was the idea behind it?
We have approached many medical doctors and many organizations. Actually, there are a lot of organizations which are also doing a good work on the low carb front. We invited them. Now, this was the first program, and while organizing, I also got a lot of recommendation that many doctors have come forward and told that please take us in this session, because in this first event, because this is happening for the first time and we don't want to miss. I really wanted to accommodate as much as possible. So I think 12 hours is the maximum we can squeeze. Yes. Let me tell you, Ira, I already have 20 to 25 medical doctors, speakers ready for second event also. I mean, it is so overwhelming. And we thought that, okay, we will accommodate as much as possible. We started with just an 8-hour concept, 8 hours per day, which really stretched to 12 hours. We didn't want to disappoint any doctor or any organization. And we kept on stretching till I think 12 hours is the maximum we can stretch.
Given the the lineup and everything about this conference, Shashi, you decided to keep it free. Tell us why.
See, I think this is a joint decision between me and Anup Singh of DLife. We thought that this is an inaugural program, and no one should be deprived of attending this. No one. I don't even want to spend 1 rupee on this. I don't want people to spend 1 rupee on this. I don't want anyone to be deprived. Let them see. This platform itself, thanks to Imagica, this has the capacity to hold 5 to 10,000 viewers at a time. We are also live streaming it in YouTube. Millions can see. And not only from India, people globally can come in and see. So we thought that this is a small service we can do for India. What is the point? See, people charge for everything. And in our individual coaching sessions, we also charge. But we thought that this dissemination of information, it should be free of cost for everyone. People should see the top brains of the world coming in and telling that low carbohydrate nutrition is a safe option. And we are going to dispel or burst many myths in these 3 days.
I believe all sessions are very relevant, Shashi, but in the Indian context, if you would want to point out a few sessions that people must watch and not miss, would you be kind enough?
I frankly, it is very difficult for me to choose anything, frankly, because it will appear like favoritism. Because let me tell you that each and every session is designed for everyone. each and every session. Please don't miss. Who's going to speak on this? That we have endocrinologists, we have gynecologists, we have orthopedicians, we have surgeons, we have GPs, we have cardiologists who are going to come to this session. I don't want to really show that this is important, this is not. I feel that, or I believe that the entire 46 sessions are very, very important for all of us. And I know that people cannot log in for 12 hours and see. So people can pick and choose whatever session they want, whichever that interests them. But we are going to be here for 12 hours in this seat. So we are going to have a 12-hour fasting. Each one of us, the organizers.
Yeah. So, Shashi, I'm sure we are going to burst many myths, and I think we are going to change the way we look at nutrition and metabolic health after this conference. What do you foresee, the next step, the next logical step after this metabolic conference, health conference going to be?
See, this is the beginning. We are going to hold more such conferences. So this is the beginning, but not the end. We might hold physical ones, and we will hold more advanced sessions. Now this is going to be introductory into low carb. It is a broad introduction. We are going to have more specific sessions, the application of ketogenic diet in various metabolic specific disorders. It's all in the planning stage, and we have speakers ready. So the next culmination of the effort is like we are going to have more sessions. We will also do physical sessions because there's a lot of demand for physical session, and we will hold it. And at this occasion, let me tell you that to everyone that currently we are hosted in Taj Siddharthi, Goa, and we are being treated with very nice low carb keto meals, keto snacks, and everything. So if at all we are going to have a future event, we'll be having it in this group where we'll be served all ketogenic meals or low carb meals or whatever is our preference. So thank you very much again. At the start itself, let me thank Taj Siddharthi Goa.
Yeah. So Shashi, just stay tuned. I would like to have Mr. Arun Kumar on the screen as well. Can we have him on the screen, please? Yeah. Let me introduce Mr. Arun Kumar. Arun Kumar is one of the senior most members of India's only low carb platform, DLife.in. Arun has spent 35 years in pharma, was diagnosed with diabetes in 1995, and now lives a pill-free life. Thanks to following a low carb diet protocol after joining DLife in 2015. Very shortly, he became grain-free and lentils-free. He stopped eating them and is now, surprisingly, a full-blown carnivore. I'm very proud to say that Arun is also now under my coaching for the carnivore diet protocol. I'd like to welcome Arun.
Thank you, Ira. Thank you. Actually, let me say something about the DLife first, then other things. Actually, I have been diagnosed diabetes in 1995, and having the pharma background, I have a lot of faith with the pills and injections and all. And I used to take pills for my diabetic remission. But unfortunately, till 2012, my diabetic drugs were going increasing. Then I was searching for that. And I made Anup Singh on a different platform, that is a UK-based platform, and they are dealing with the diabetes. There I came to know there is some other way also to remedy or to reverse your diabetes. So I joined after the DLife founded in the August 2014. I joined it in the March 2015, just 6-7 months back after that. And I'm very much impressed with the Anup Singh's way of dealing and restricting the carbohydrate. He gave me the formula of 100 gram carb per day is to be restricted for the diabetes. And it has a lot of response to my blood sugar. So I decided within 6 months to be grain free, another 2-3 months be lentils free, and slowly my diabetic medicines were reduced, and now there is no diabetic medicine I'm taking.
Okay. How
Yeah.
low carb change your life? Because you followed low carb after you met Anup Singh and came into DLife. How do you think that has changed, the low carb nutrition has changed your life?
See, I just want to tell you one thing that in 2012, when I was visiting my Indo, he told me that if your blood sugar will not be in control, so next time I have to prescribe insulin. so that it should be controlled. That was the alarming wave in my mind. And then I start searching. Then I met Anup Singh and he told me it was low carb. Low carb had changed everything in my life. First, I get rid of all the meds. Second, I get healthy. I am having more energetic. And look-wise also people are saying that you are looking younger than earlier. So these are the things low carb has changed. But basically it has changed my blood sugar control. It has changed my HbA1c, etc., etc.
Yeah.
Here one thing I just like to point. I have a lot of regard for Anup Singh and Shashi because they are the old member of the D Life along with me, and they are guiding also me how to move and how to change this diet schedule. That's what. Yeah.
We are kickstarting a very critical event today, Arun. What are your thoughts about on the Metabolic Health Conference that India is seeing for the first time? Tell us something.
Mira, this is a historic event, and I would like to say this is India is watching first time such event in India because so far actually we are planning and Shashi and Anup are the main pillar of this event. They were planning, and I know something about that, but it was really very great effort by the Shashi and Anup to bring all these top-notch speakers of the world on the low carb field, and they will speak it up. So, in my view, this will be the one of the landmark in Indian low carb field, low carb side. So, I just hope that people of India should watch and should get benefit of this event because you also know, I also know, and others also know, India is quite metabolic unhealthy. Almost, I think, more than 100 million people are having diabetic, and more will come. This is the one side. Apart from this, other metabolic syndromes like hypertension, thyroid, and then mental disorder also, all are related to the low carb. So India will be benefited from.